Hey, welcome to Life After Nursing School. I'm your host, Caroline Dana, aka Nurse Coach Caroline, and I'm here to help you, the new nurse, thrive in your career. As a former nurse recruiter, nurse manager, and now your personal new nurse career coach, I'm obsessed with making sure you don't just survive your first couple of years at the bedside. I want you to absolutely rock them. From the challenges to the triumphs, I'll be right here with you, giving you the real-world advice and support that you need to shine. Whether you're in nursing school getting ready for life after, or you're already out there in nurse life feeling overwhelmed or even questioning your confidence, I've got your back. I'll be sharing tips, tricks, resources, and strategies that are just for you. We'll dive into everything from landing that dream nursing job to slaying imposter syndrome, and most importantly, how to keep that spark alive and stay the vibrant and amazing nurse that you are. So if you're ready to tackle the things nursing school did not cover, like how to build a career, trust yourself, and keep your passion strong, then get comfortable because we are about to dive in and make nurse life the best life. Hey there, I'm so glad you're tuning into this week's episode. This one might be exactly what you need to hear to step into the most confident version of yourself as a new nurse. Before we dive in, quick reminder, please pause and leave a rating or review for the show. It really helps the podcast's searchability and lets me know that you're out there on the other end listening, finding value, support, or maybe even a little entertainment along the way. So thank you for doing that. It really means the world to me. Today, we're talking about developing critical thinking skills as a new nurse, and specifically how you can use ChatGPT as a tool to strengthen those skills. Critical thinking in nursing is not just about memorizing facts or following checklists. It's the ability to take what you know, combine it with what you're observing, anticipate what might happen, and act appropriately. It's about putting the pieces together when the picture isn't clear. Critical thinking isn't learned overnight. It's built from a combination of classroom knowledge, clinical experience, and tons of practice in real-world scenarios. It's normal to feel overwhelmed as a new grad. Connecting the dots takes time, but there are ways to strengthen that muscle, and ChatGPT can be a surprisingly powerful partner in that process. Okay, I want to give you some personal stories of my own with ChatGPT. I love ChatGPT. I also stole that nickname from Jenna Kutcher. I use ChatGPT constantly, not just for work, but in my personal life too. When I planned a trip to Ireland with my mom, I gave ChatGPT all the details, the dates, the hotels we were staying at, the rental car, even the fact that we like to start our day early with a cup of coffee and be done exploring by dark. ChatGPT built us a custom itinerary that worked perfectly within our budget and preferences. As a passenger princess, this was huge for our trip. I also use it weekly for meal planning, which I've shared on the show, but I will give it a prompt like create a meal plan for a family of 5 with 3 picky eaters under the age of 8, low in sugar, easy to prepare. Then I push it further. Now give me a grocery list organized by aisle and a prep guide. Boom, whole week mapped out. I've been doing this for weeks. Recently, I even asked ChatGPT to create an affordable skincare routine for me. You can really use it for anything. So that really got me thinking. If ChatGPT can save me hours in my personal life, why not use it to practice and speed up the mental processes that make new grads better nurses? People are constantly reaching out to me on social media saying that they're struggling getting off orientation and they are struggling with prioritization and being efficient and understanding what task or need needs to be done next. And it's so hard. I can only do so much through, giving tips through social media that it really got me thinking, how can I help leverage this tool? This is almost like your backup preceptor. So let's break it down. The nursing process is assessment, diagnosis, planning, implementation, and evaluation. As we know, the nursing process framework sits at the heart of nursing critical thinking, and ChatGPT can help you practice each step. The first step is assessment. Gather data like vital signs, patient history, and what you see at the bedside. You can practice this by giving ChatGPT a patient scenario. For example, I'm caring for a 37-year-old female with type 1 diabetes and hypertension who just had a laparoscopic cholecystectomy. Her vitals are stable. What should I assess right now and why? ChatGPT might highlight pain, incision sites from the gallbladder removal, blood sugar monitoring, or infection risk, and helping you think through what is most important. This trains you to collect relevant information quickly and systematically. Once you have that information, you move into the next part of the nursing process, which is diagnosis. You could ask, based on the scenario, what potential nursing diagnoses could apply here? ChatGPT might suggest acute pain, risk for infection, or unstable blood glucose. Decide which is most urgent and why. After assessment and diagnosis comes planning. And this is where nurses decide on priorities and creating a care plan for the patient. So here you might role play with ChatGPT and ask, help me prioritize interventions for this patient. The response might include pain management, glucose checks, incision monitoring, ambulation, and patient education. ChatGPT can help you practice writing outcomes like by the end of the shift, the patient will verbalize pain less than 3 out of 10. This builds your confidence in planning care, which is one of the hardest skills for new nurses to master. The next step in the nursing process is implementation, where we as nurses put the plan into action. This is a great time to practice clinical reasoning and communication. For example, you could say, I'm administering 2 milligrams IV morphine. What do I need to watch for, and how should I explain this to my patient? ChatGPT will remind you about respiratory depression, sedation, constipation, and monitoring steps, reinforcing your safety checklist. You can also role play SBAR handoffs or physician calls and let ChatGPT refine your wording so you sound clear and confident. Finally, we get to the last step of the nursing process, and that is evaluation. This is where you decide if your intervention worked. You might run through a follow-up question like, if I gave morphine and the patient's pain went from an 8 to a 2, but their respiratory rate dropped to 8 breaths per minute, what should I do next? This forces you to think not only about whether the intervention was effective, but also about any complications. Practicing evaluation reminds you that nursing is a continuous cycle of reassessing, adjusting, and refining patient care. Now that we have reviewed how to incorporate ChatGPT in the nursing process, let's talk about other practical ways to use ChatGPT for critical thinking in nursing. We can start by practicing clinical scenarios. Ask ChatGPT to generate a patient case. For example, give me a med-surg patient with diabetes and shortness of breath. If there's a condition you're unfamiliar with or one you recently encountered and want to understand better, use that as the focus. Before you read any guidance, sketch out your own plan. What you'd assess first, how you'd prioritize using ABCs or Maslow's hierarchy, what your initial action would be, what complications or orders you'd anticipate. Then ask ChatGPT to walk you through the ideal reasoning and compare it to your approach, noting where you were aligned, what you missed, and any alternative pathways you hadn't considered. This drill strengthens data gathering, prioritization, and anticipatory thinking. Another way you can use ChatGPT is maybe after a shift, you turn to ChatGPT and use it as a tool for reflection and debriefing by typing out a situation that maybe left you feeling unsure. Maybe there was something that you missed, or maybe a conversation that was hard for you to digest. Instead of replaying the event, ask ChatGPT questions to better understand what happened. This will guide you through a more structured reflection process and help you identify gaps in your reasoning or areas where you can improve. It's also a helpful way to process difficult or even traumatic patient experiences, giving you a safe space to talk through what happened, gain perspective, and walk away feeling more at peace. If you're struggling with lab values, medication, or pathophysiology, use ChatGPT to break things down into simpler terms. Start by asking it to explain a concept in plain language so you can build a solid foundation. Then take it a step further by pushing deeper with follow-up questions like, what would happen if this lab trend continued? Or how does this medication compare to other options? This approach not only helps you understand the basic, but also challenges you to think about cause and effect and the bigger clinical picture, which is really a great way to strengthen and develop your critical thinking. You can also use ChatGPT to practice prioritization, which is one of the trickiest parts in critical thinking for new nurses. Try prompting it with something like, give me 4 patients and ask who I should see first. Once you get the scenario, make your decision and explain your reasoning. Then ask ChatGPT to critique your prioritization. This exercise helps you practice applying frameworks like ABCs or Maslow's hierarchy, while also giving you instant feedback on how safe and effective your choices are. You can also use ChatGPT to practice communication, especially for situations like SBAR handoff or provider calls. You might prompt it with, help me script a call to a physician about a patient with a critical potassium. ChatGPT will walk you through how to present the information clearly and concisely, which helps you to practice articulating your reasoning under pressure. Over time, these role plays can make you more confident and effective when communicating with physicians, peers, and other members of the healthcare team. We can also use ChatGPT to challenge our own thinking. You can literally type, play devil's advocate. What else should I be considering in this situation? And let it point out alternative perspectives that you might have missed. This exercise helps you move beyond tunnel vision and think critically and comprehensively about patient care. ChatGPT can also be a powerful study support tool. You can ask it to generate NCLEX style or orientation style practice questions on the topics that you're working to master. After answering, have ChatGPT explain why each option is correct or incorrect. This reinforces your knowledge, but also helps you understand the reasoning behind each answer, training your brain to think beyond memorization and into real critical thinking. Okay, before we wrap up, I do want to share a couple of important notes and disclaimers. First, always remember to respect HIPAA. Never put patient identifiers or personal information into ChatGPT. Keep everything de-identified and hypothetical. That's really important. The more detail you give ChatGPT, the better the responses, the clearer your question, the more helpful the feedback. Don't be afraid to push back. You can literally say to ChatGPT, I still don't understand. Explain it to me in another way, and it will. You can even ask it to come up with creative ways to help you memorize content. I had a nursing student once use ChatGPT to create a song to remember all the cranial nerves, and it was catchy. That said, ChatGPT is not a replacement for your preceptor, your peers, or real world experiences. It's a supplement, a safe sandbox that you can practice in. And here's the truth. Using ChatGPT to grow your critical thinking will only be effective if you're self-aware enough to identify where your knowledge gaps are and humble enough to say, I don't know this yet. It requires you to actually dive into those topics and spend some time learning. And that is really where the growth happens. I'm sure someone in nursing school told you that we as nurses are lifelong learners and ChatGPT can help you grow as a new nurse, but only if you use it wisely. Always protect patient privacy, be specific with your prompts, ask follow-up questions, and even get creative with how you use it. If you're willing to be honest about what you don't know and put in the time to fill those gaps, ChatGPT can become one of your most powerful learning tools to build your confidence and sharpen your critical thinking. I want to leave you with 3 actionable challenges. Challenge 1, open ChatGPT and type, give me a med-surg patient with shortness of breath and a history of diabetes. Before you read the answer, write down what you'd assess first, what your top priorities would be, and what complications you'd anticipate. Then compare your reasoning with ChatGPT's response. Challenge 2, the next time you get home from a shift, type out one situation that left you feeling uncertain. Then ask ChatGPT, what questions should I ask myself to better understand what happened? Notice what insights you uncover and how it helps you reflect differently. Challenge 3, ask ChatGPT, give me 4 patients, ask me who I would see first, decide on your answer, explain your reasoning out loud, and then let ChatGPT critique your choice. This is a simple way to practice prioritization without the pressure of a real patient load. Try these out this week and see how they help you think differently. Send me a message or tag me. It makes my day to see you taking these tips and putting them into practice. Thanks for hanging out with me today. Don't forget, leave a quick review so other nurses can find this show. Until next time, keep practicing, questioning, and becoming the nurse you're meant to be. As always, I have one hand for me and the other for you. Signing off. Well, that's it for today's episode of Life After Nursing School. I hope you feel more confident and ready to tackle the challenges that come with starting your nursing career. Remember, the first year or 2 might not be easy, but with the right mindset, you can overcome anything. If you found value in today's episode, I'd love for you to hit that subscribe button so you never miss a future episode. Also, please consider leaving a review on your favorite podcast platform. It helps so much in reaching other new nurses like you. Thanks for listening, and remember, you've got this. Take care and see you next time.